I'm too fast or anything, you can just ping in the message, okay, so that I can follow accordingly. So yes, so coming on. So as we all know, dissertation is one of the compulsory thing that is there whenever you join any PG course or DM course, MCH course, or if you want to do any PhD. Okay, this is a part of the research methodology. So whenever, even as a faculty or you become a doctor in any respective branch, so again you need to publish your own articles, journals, everything. So all these things will follow these common things, right? So this is always a question mark. So every student will feel, okay, doing a PG is fine, I want to do a PG, but why this dissertation, why this thesis, right? So everybody have this in their own mind. So why am I supposed to do all these things? So one of the biggest thing is dissertation. So the biggest headache a student feels is dissertation. So today this session will be in order to ease you all that dissertation is not any tension. Okay, you can do it very easily. The only thing is you need to understand how to do it and what exactly to do it. Second most common challenge a PG student faces, or what to say, any faculty may face, is understanding this biostatistics, right? So what test to apply, what is this p value, what is the significance, so how to do the results, so do I need to learn SPSS or any other software to do the analysis or any of these things. Okay, so today my topic will also be in order to help you out, to ease you out as to what biostatistics is exactly required. I will not be taking in detail because dissertation itself is a long topic and biostatistics itself is a separate branch. So if you have to go through, you may require more time. So I will be just focusing on what is dissertation, what are you supposed to write, or how do you go with the dissertation, and then second is what are the common biostatistical tools that is required for you to complete your dissertation. So this will be the primary focus area. So moving ahead, so what exactly is biostatistics? It is nothing but a branch of applied statistics in the area of biology. So here in biology, we want to speak about epidemiology, or it can be related to medical sciences or the health sciences or the pharmaceutical company or the pharmaceutical science, the environmental science exactly. Or in order to say it's application of the statistical technique to the scientific research in the health related fields. So we all are doctors, we face a lot of challenges and we face a lot of cases or many of the new things. So we want to apply this particular statistics. Now we all know. So every year the data or the census data, which is done in once in 10 years, all the data we read, the neonatal mortality rate has decreased to so and so, the life expectancy is increased to so and so, so the maternal mortality is decreased to so and so. How do we get this data? This is how we are applying the statistical techniques in day-to-day life. So what is dissertation? So dissertation is nothing but a research document, okay, or a project in the area of interest of the student, or it can be a field of study which is contributing to the betterment of the society or to the healthcare, or it is going to add on to whatever is the known knowledge. It is called as a research document. So it is usually mainly used for the academic purpose as a research project that each and every student should exactly know how to make a research document, how to write a thesis or a dissertation, how to understand these things, and later on in his career, he will be doing various research in order to contribute to the betterment of the society. And this is a part of the master's degree right now. So we will be going with what is dissertation writing. Mainly, Vancouver style of referencing. Many of the students fail to or to say, do a referencing in this particular Vancouver style properly. So we will discuss on that. Third is study design and sample size. Most of the students get confused what exactly is the study design that has been applied in their study. So even if you're doing comparison, you tend to write it as an RCT, randomized control trial. It is not exactly so. So we'll be doing with, and then most important, sample size calculation. This is always a headache, right? So PG students usually come to us saying, sir, the sample size is more, I want to reduce it. Or so if you say the sample size is less, you want to increase it, which is a very, very rare entity. And then we'll be going with the analysis part, that is univariate analysis, bivariate analysis, and then what are the various statistical tools or methods that we can use in order to make a presentation. So coming to this, yes, is dissertation a burden? Yes, most of you feel it is, but exactly it is not so. Once you can understand what exactly it is, then this is no more a burden. So we'll come with the common scenarios. Okay, what exactly happens as soon as you join a PG? The first thing that runs in your mind is, okay, which topic to select. So there are a few scenarios. One common scenario is enthusiastic guide and enthusiastic student. So usually the guide is very enthusiastic. He says, okay, you can do this, you can do that. So this is a particular thing, please do this. Because you just keep on adding the things. Or a student is very enthusiastic, he wants, oh sir, I can do this, sir, I will do this, sir, I can take this parameter also. So if both are enthusiastic, then there is no problem. The only thing is you require more time. Second scenario is enthusiastic guide, but a lethargic student or a non-interestable student. So it is going to be a headache to the guide. So the guide is imposing, okay, you can do this, you can do that, please do this. This is a new thing, this is a new parameter, you can do this. But the student is really not bothered. He just want to finish off his degree, and dissertation is just a part of his degree. So this is going to be a headache for the guide to see that the student will complete the dissertation in time. The third scenario is lethargic guide and enthusiastic student. The student is very enthusiastic, so he wants to do many things, he wants to do all the type of research, but the guide is saying you do whatever you want, I'll just sign in your dissertation. So these are few of the scenarios that we use. So this is a manageable thing because the dissertation is going to be done by the student and the guide is going to help out, right? So these are the few common scenarios we see in the day to day, what you say, in the colleges. So yes, coming to dissertation, so what are the various topics under which you are going to write the dissertation? The first one is you'll be going with the introduction, then you'll be writing the aims and objectives of your study, then the heart of the dissertation is your review of literature. So if you are doing a proper review of literature, then 50% of your dissertation is over. Okay, so the 50% of the dissertation rolls around or roams around your reviewing the literature or the art of writing the literature. Then important thing is methodology, that is how exactly are you doing your study. Then comes the results part, then you're going to do a discussion, then what is the conclusion of your study, then you're going to write the summary, then most important references, because if you fail to do a proper referencing or quoting of whatever you have done, then it is going to plagiarism, right? Then the few minor part is annexes, right? So it will be abstract, you have informed consent, you have a pro forma, questionnaire, master chart, abbreviations, key to master chart, all these things. Also, any photograph or any figure that you have captured. For example, you are a surgeon, you are an orthopedician, you're doing a study on, comparing the various suture materials or comparing the surgery. So you have taken few photographs. So all these things will be added in the particular annexes. Yes, so point to note, there is something called as IMRD structure. So what is IMRD structure? That is introduction, methods, results, and discussion. So what exactly is introduction? You are going to say, why did you start? Okay, so why are you doing this particular study? Is it going to make any difference in the existing scenario? Now, for example, we know the prevalence of diabetes in India is, for example, in the rural or in the urban, so collectively around 10%. So if you want to do a study on what is the prevalence of diabetes, so why are you doing this study? So is it going to make any difference? Is it going to alter anything? So what is the purpose of your study is what you're supposed to write in the introduction. Coming to methodology, what did you do? So now you have decided to find the prevalence of diabetes. So what are you going to do? How are you going to do your study? From the planning of your study to execution of the plan with appropriate methods, everything you have to justify in your methodology. So what was the sample? Now we have taken 100 students or 100 people or 100 patients. So why exactly have you taken 100? So you have to justify each and everything that you have done in your methodology. Now you are going to do a surgery or you're going to compare. Now, for example, there is a appendicitis case. You want to compare whether the conventional appendicectomy or the laparoscopic appendicectomy. You want to compare these two. So you have to justify what method is it. You're not going to harm the patient. Everything has to be explained in the methodology. And coming to results, results is nothing but what did you find. So where did you start and then what did you find? It must be relevant to your objective. Okay, whatever may be objective. Now, for example, if your objective is to find the prevalence of diabetes, then the result should say the prevalence of diabetes was found to be 10%. It should not be going somewhere else. Okay. Then coming to discussion. So what does it all mean? That means to say you are supposed to interpret your findings and then compare it with the other findings. Now, for example, my name is Vinayak. So I'm doing a study on what is the prevalence of diabetes. Now there is one more doctor, Dr. Raghu, he has done a study in Bangalore. So now I want to compare for example, the prevalence of diabetes in my study is 10%. Similarly, a study conducted by Dr. Raghu in Kolar or in Kolkata was 12%. So that is how you are supposed to do the discussion. Okay, so coming to introduction. So what are the, you are supposed to write introduction maybe in a page or a 1.5 page, but not more. It is just an introduction to what you're going to do. So first point is zoom in. You have to focus on the topic. That is, what is the purpose of your study? Why have you selected this particular topic? And then you have to write a background. That is, what is the scope? especially the burden. Okay, now for example, the prevalence of the incidence of dengue is so and so, or the prevalence of diabetes is so and so, prevalence of hypertension is so and so, or the incidence of leprosy is so and so. So what is the significance? Why are you choosing this particular topic? That is what you're supposed to write. Then most important is knowledge gap. Okay, so what is the existing knowledge that we have, and then is there any recent changes in whatever knowledge is known, or is there any newer technology, newer adaptation, or any newer technique in procedure, and then is there any altered trend? Okay, so all these things you're supposed to write in a glimpse. Okay, not in detail but just in a summarized way. And then finally rationale. What is the novelty? That is it a new thing, or is it not done in your setting? Now for example, prevalence of anemia, we know that the prevalence anemia is prevalent among the reproductive age group. Then why are you doing it? Is there any specification you are doing it, any particular age group, any particular setting, maybe in the lower socioeconomic status, or maybe in the school going girls, something like that. So is there new novelty? It must be something new. Okay, that is what you're supposed to write in the introduction. Then coming to aims and objectives is very very important. We have to be specific. Okay, so one should understand what are you trying to do, or what you're trying to find, just by reading your objective. It must not be a multiple objective. Don't become too ambitious. Okay, now for example, the objectives of my study are to find the prevalence of diabetes, to find the complications of diabetes, to identify various risk factors of diabetes, to in order to find the diabetic retinopathy, diabetic nephropathy, or I want to see the prevalence of diabetic foot ulcer. No, please don't go for multiple objectives. Okay, stick on to a particular specific thing. Be specific. Okay, one should understand what are you trying to do. Okay, so then do not go for multiple objectives. Stick on to one primary objective, then maybe two or three secondary objective. Okay, so that is what you're supposed to do in your aims and objectives. And this objective is very important, because whatever objective you have selected, at the end of your study the results should answer that particular objective. So what is this review of literature? Yes, this is one of the most important thing, or this is the heart of your dissertation. So it is the summary of all the reviews from various research literature that you have collected related to the current study, that you have studied or that you have collected through various portals available. Okay, so it helps in order to discover what is already known. Now for example, if I want to say, we'll take an example of what is the prevalence of diabetic foot ulcer in diabetes, type 2 diabetes mellitus. Okay, so what is already known? We know that the diabetic foot ulcer is one of the known complication of type 2 diabetes mellitus. And then you want to go with what more can be done, especially in your study. So do you want to prevent the occurrence of diabetic foot ulcer? If so, then how are you going to do it? Is there any newer methodology? Is there any new treatment available, or is there any new preventable thing that is there? All these things. Then you have to organize the written presentation of what has been published on a topic. You have to organize. Now for example, if we take this particular topic, okay, the prevalence of diabetic foot ulcer among type 2 diabetes mellitus patients. So how will you go with? First you have to suppose you're supposed to define what is diabetes. Then you have to classify what is diabetes: type 1 diabetes, type 2 diabetes, or gestational diabetes, or MODY. So which are the four types of diabetes. Then you will go for type 2 diabetes, because that is what you're going to do. You're going to look in the type 2 diabetes. Then in type 2 diabetes, again you will go with what is the pathophysiology, what is the normal anatomy of the pancreas, or what is the function of pancreas. And then we will write about the pathophysiology, what is insulin resistance. And then you will go with what is the clinical features of type 2 diabetes mellitus, what are the treatment available, what are the investigations that are available. Then you will write the complications of type 2 diabetes. Now in the complication you have to choose the occurrence of, that is, diabetic foot ulcer. So we will start with diabetic foot ulcer. So what is the prevalence of diabetic foot ulcer? What is the presentation of the diabetic foot ulcer? Okay, how does the ulcer look like? So what are the various treatment available in that particular diabetic foot ulcer? So this is the order in which you will try to write the review of literature. At the end, you're supposed to compare with the relevant articles. So after you write all these things in this particular manner, at the end, you're supposed to compare it with the relevant articles. The same topic might have been done in various other setting, maybe in abroad, or maybe in the local, or maybe in the local vicinity, or in your particular country, all these things. So first, whenever you compare, you are supposed to compare with the nearest place. Now for example, if you are doing a study in Bangalore, then you are supposed to compare it with relevant articles that are done in Karnataka, then maybe in neighboring states, then maybe in India, and then maybe the neighboring countries, other countries, because the presentation or the prevalence or the incidence changes from one place to other. Now you cannot compare the prevalence of diabetic foot ulcer in Karnataka to that is done in US, because entirely there is a change in ethnicity, change in the race, change in the type of occurrence, all these things, right? So that has to be in such a way. So what exactly is relevant, what you say, review of literature, that is seek information. So first thing is you're going to scan through literature, a thorough literature scan, or literature has to be searched for. Okay, so what are the various sources where you can seek the information? It can be your books, or it can be the journals which is available in few of the indexed things like PubMed or Scopus, all these things. Then it may be any CME, it can be from any conference, it can be from any newspaper articles, all these things. So you are supposed to scan. First, you are supposed to make the headings under which you want to write the review of literature. As I told you, diabetes, risk factors, all these things. So you have to search for the literature, enough literature, and then you're going to organize the collected information from which is most important to least important, most recent to the past. Now, for example, when you're writing the prevalence of diabetes or something, you're supposed to compare it with the now with the 2023. So what is the prevalence in 2023? Maybe plus or minus 5 years, or maybe backwards to 5 years from 2018. What was the scenario? You cannot compare an article which was done in 1980, because from 1980 to 2023 there's been lost a lot of drastic changes, right? So you cannot compare such articles. So to compare with the most recent one, then you are supposed to go to the past, most important to the least important topics, and then finally you are supposed to tabulate each of the study and compare it with the relevant articles. So this is how you are going to review the literature. Whatever you have collected the literature, you are supposed to do in such a way. So now what are the various sources? So usually the books, standard books are your source of literature, but most important are these journals. Okay, so this in a particular topic, various articles or various studies has been done and in published in various journals, so you're supposed to see the journals. Then any conference, okay, or any CME, in that particular conference or CMA, this particular topic has been spoken of. So then you can take that particular thing. Then any other thesis done by any student who have already given a particular result. Then it can be encyclopedia or any research reports, or even it can be a newspaper clipping or electronic database. So all these things are the sources for your review of literature. But the it all carries a weightage also. The weightage is more for the journals or original articles, then the books, then review articles, then comes all your magazines or conference paper or CME or any newspapers, all these things. But the weightage is more for your journals. That means to say, when you're doing a review of literature, 80% of the source must be through your books or the journals. Okay, you cannot take 80% of the newspaper clipping and 20% from the books or the journals. No, you are supposed to see for the original articles in the journals, then books, which must be at least 75 to 80% of the source of your literature, and then you can go with the other theses or conference or research reports or newspaper clippings, all these things. So writing a review of literature is very very important, and if this is done properly, then 50% of your dissertation is over. Okay, the 50% of your dissertation is over once you write this literature exactly or in a prescribed manner. Okay, so this is the heart of your study. Then coming to methodology, one of the most important, this varies from study to study. Okay, so it depends on what type of study you have chosen, what is the objective, okay, what is the study design that you have chosen. It can be a cross-sectional study, cohort study, case control study, RCT, all these things, or it can be a clinical trials, ecological study. So depending on that particular thing, you are going to write the methodology, and then, excuse me, you are supposed to explain it in a simple terms, that what exactly have you done in your study. Okay, so what are the headings under which you'll write the methodology? First one is source of your data, that is what is the target population that you have included in the sample size. Now for example, if I'm saying prevalence of diabetes mellitus in a population, so who is the target population? Is it a particular village? Is it a particular city? Is it a particular, what you say, people working in a particular factory, or is it in a hospital done, all these things? It is a source of data. So who is the source of your data? Second is study setting, whether it is a hospital based study, are you doing it in a tertiary care hospital, are you doing it in a medical college, or are you doing it community, that is are you going village to village and choosing the people from there and doing it, or is it any facility based? That is, are you doing it any particular industry, or are you doing it a particular Anganwadi, primary health center, district hospital, all these things. So which is your study setting? Then third one is study design. So which is the study design you have chosen or you adopted to do this particular study? It can be cross sectional, as I told you. These are the four most common thing then, that is cross sectional, cohort, case control, and RCT. Usually for the PGs, it is very, very difficult to do RCTs or case control study or even cohort study. So usually most of the theses will be revolving around this cross-sectional study. 80 to 85% of the thesis or the dissertation, the study design that is chosen will be your cross-sectional studies. Okay, then study period is very, very important because you're supposed to mention, usually it is 1.5 year to 2 years. That is the study duration. It includes from choosing your topic up to submission. Okay, so what is the duration? Usually 1.5 to 2 year is the maximum duration that you have by which you can complete this particular dissertation. Then comes to sample size, which is the most common thing, and most of the students will have a query, right? Justify your sample size. So justification of a sample size is very, very important. There are three ways in which you can justify the sample size. Now, for example, if you have chosen 100, so most of the student will choose 100. I don't know, it has become a, it is the most common parameter. So 100 is the sample size. Most of the students go for that particular thing. So if you have taken 100, then why have you taken 100 is what you're supposed to justify. So there are three ways. One is sample size calculation. So based on the study design, calculate the sample size using the given formula. That is the best one. Second one is, now for example, you don't have any particular relevant study, so you don't know what to do. You can do a pilot study. Okay, you can take some 10 samples or 20 samples, do it, and then see what is the particular thing, and then you can take it as a, what is a reference to calculate your sample size. Second thing to justify sample size is universal sampling technique. That is, all the patients who are coming to your hospital or in a particular topic, you are taking them in your study. That is called as universal sampling. Third justification is, now for example, you are going to study, what you say, the incidence of appendicitis or the incidence of colon cancer, colorectal cancer in a tertiary care hospital. So what you will do, you will say the number of cases or the patients that you get in your hospital on an average for the last 3 years. So based on the data available in your hospital registry or in the MRD department, the average number of patients of this particular disease you get is somewhere around 50 or 60. So you take an average of the last 3 years, and then you can say, yes, so based on the data that is available in our hospital, based on the patient load that we have in our hospital, I am taking a sample size of 50 or 60. That is how you can justify. So these are the three ways where you can justify your sample size. But always the best way to justify sample size is calculating a sample size. Then you will write the inclusion criteria and exclusion criteria, which is very important because you have to be very specific. Whom are you including and whom are you excluding? You cannot write the patients who are giving informed consent are included. Definitely you can include only once they give you the informed consent. So, or you can, so that is the reason you have to write appropriately what is the inclusion, what is the exclusion. Then comes the crux of the methodology is sampling procedure or method of data collection. Here you are supposed to write in detail how did you collect the sample size. That is, now you have chosen the 100 sample size, you have chosen the 100 appendicitis cases. Now how will you go with? So are you going to interview, then you're going to collect a detailed history, then you're going to do a clinical examination, then you're going to identify the type of appendicitis, then you decide which surgery is going to be taken, laparoscopic surgery or open type of surgery or conventional technique. Then what is the duration? Is it done by a single surgeon or multiple surgeons? Okay, then what was the finding, intraoperative finding, postoperative finding, or what you say, procedure, any antibiotic coverage is given, postoperative, how is it done, how frequently will you see the dressing, how frequently will you change the dressing, what will you observe for postoperative pain, postoperative requirement of analgesia, how fast can they recover, what is the duration of hospital stay, all these things. So that is what you're supposed to mention. Okay, then the last part is definition of study variable or parameter. Now, for example, you are going to do a study on non-alcoholic fatty liver disease. So you want to see what is the prevalence of non-alcoholic fatty liver disease among adults who are aged in between 30 to 60 years. So now, if you are going to see this, so what are you checking for? Are you seeing for lipid profile or are you doing an ultrasound scan? So if you're doing the lipid profile, you have to define the what you say, the lipid profile, so total cholesterol. So what exactly is the parameter looking for? More than 240 is high cholesterol, 200 to 240 is borderline, less than 200 is normal. So triglyceride more than 130, less than 100. So you're supposed to define each and every study variable that you have included in your methodology. Now if your topic is to define to see the anemia prevalence, then you have to define what is anemia. If she is a woman, if it's a man, how do you say or when do you say a particular person is anemic? Less than 7, less than 10, less than 11. So definition of the study variable is very, very important. Also, what are the definitions that you are saying? If you are saying a dengue case, so who is a dengue case? How do you define this particular thing? All these things. So this has to be mentioned in your methodology. Then before you complete the methodology and go for the results, there's one particular thing, that is statistical analysis. So this is a short note you're supposed to write on which statistical test has been used. Usually what PG students do, usually they ask the statistician, okay, for this particular study, what is the sample size? Second thing they'll ask, what statistical analysis will be done, what test will be done, T test, Z test, chi-square test, ANOVA test, all these things, right? So what exactly you're supposed to do, you have to write in the statistical analysis part. Then coming to presentation of your study finding. Now, after your review of it and everything, you have collected the data, you have entered it in the master chart, then you have analyze the data, and then you will present it in your results. You are present in what way? In tables and graph. Usually the tables will be frequency table, association table, and then in the graph it can be a bar diagram or what is a chart or line diagram or pie chart, all these things, right? So this is what is your results, and then you have to interpret below the table and the graph as to know. For example, we found in our study that 30% of the patients were aged less than 30 years, 50% were aged in more than 30 years, like that. That is how you are supposed to interpret whatever you have found in your study. Then coming to discussion, this is nothing but you are going to summarize your results and then you are going to compare it with the relevant article. Now, for example, there was a study conducted by so and so in different place. Now, they have stated that the prevalence of diabetes is 10%, but in your study, you found that the diabetes prevalence is 8%. So, how will you interpret? You will say the prevalence of diabetes in our study was 8%, whereas a study conducted by so and so in Kolkata found that the prevalence was 10%, which was slightly more than the findings in our study. Or a study conducted in so and so reported that the prevalence was is only 5%, which was less or which was lower than what we found in our study. You can say the complication or the diabetic foot ulcer complication was 50% in a study, which was way more compared to a study done by so and so, which was just 10%. So this is how you're supposed to interpret. And you're not going to discuss all the parameters. You will discuss only those which are included in the objective, which are your area of interest. Okay, don't compare each and everything, don't discuss each and everything. Now, for example, you cannot write, okay, the gender was 50% in my study, 50% were male in my study, whereas 40% in other study. The mean age was 10 in our. Okay, you can say the age, but most of the parameters are not required. Use the parameters to discuss, that is the objective that you included in the objective or the area of your interest. Okay, and then you can state whether your findings were contradictory to the other findings or similar to the other findings, all these things. Okay, that is how you discuss. Then other parameters are conclusion, that is the final outcome of your study. In conclusion, you're just supposed to mention in a short paragraph, that is what was your objective and what is the conclusion based on that objective. Now, if your objective was to find the prevalence of diabetes, then the conclusion must be the diabetic prevalence in my study was found to be 10%. That is all. So it must be specific to your objective. Don't write anything else. But summary, what is summary? It's a detailed report of your finding. So whatever you have found in your result part, you can write it in the summary. So that is whatever you find in the result, a detailed summary will be it will be written in summary. Okay, then what is abstract? Abstract is nothing but a trailer of your study. So how have you done? In short terms or in a concise manner, you will write the abstract, which usually will be less than 300 words or 250 words or more than less than 400 words, not more. Okay, it will be a concise one. Then recommendation. So what exactly is the recommendation? That is, what would you recommend the policymakers or the clinicians based on your finding? Now you found that laparoscopic appendicectomy was more better when compared to what you say conventional appendicectomy. In terms of what? In terms of hospital stay, in terms of duration of the surgery, in terms of intraoperative complication. So in such a way, so you'll find, and then you're going to recommend. So I recommend from my study that most of the appendicectomies can be operated, appendicitis can be operated through what you say laparoscopic appendicectomy procedure when compared to so on. So because this is having so many advantages, that is what you're going to recommendation. Okay, the prevalence of diabetes is found to be 20% in my area. So I would recommend the government to implement the NCD program in this particular locality to strengthen the or to strengthen or to intensify the program in my setting. So these are recommendation. Then comes to limitation. So now what was the limitation of your study? One of the most thing is generalize. You're supposed to generalize. Okay, now you are doing a study in a particular college. Okay, you're taken only 100 patients, and then you have found out that the prevalence of diabetic foot ulcer was 20%. Now your finding cannot be generalized to the entire India, right? Because you're taking only 100 sample, and then you're trying to replicate it to the 130 million or 130 crore population, right? It is not possible. So that will be a limitation. So you are supposed to write the limitation of a finding, or you could not do so and so, or you could not find this particular parameter in your study. That will be a limitation. So if the sample size is less, you cannot generalize your results to a wider population. You can just say the prevalence was 20% in our finding, in our setting, and then further research is required with larger population in order to generalize it to a wider population. Okay, then comes your annexes, which will be usually abbreviations, your consent form, your study performer or the questionnaire that you have adopted, master chart, key to master chart, all these things. So these are the various other parameters that will be included in your dissertation. Okay, so yes, now comes the important part, that is referencing. Because if you don't quote each and every information that you have collected or that you have written in your dissertation, then it will become plagiarism. And every university or have their own guideline of plagiarism. Usually 10% is allowed or 15% is allowed, like this. But usually maximum limit is 15% as far as I know. And if the plagiarism is less, then the quality of your study is more. So that is the reason why you're supposed to quote each and every particular information that you've collected. And most of the times in our dissertation thing, the common style of referencing is Vancouver. So now how exactly to use this particular Vancouver style? So this is a depiction you can see here. Vancouver style, when you're taking a journal or an article. Okay, first you are supposed to write the author. In Vancouver style, you can use up to 6 authors. And if there are more than 6 authors, after the sixth author, you will write et al. Okay, but if there are less than 6 author, then you are supposed to write each and every name of the author. Here, for example, if the name of the author is Vinayak H. Kashyap, then you are supposed to write Kashyap VH. That is how it is written. Okay, usually the second part of the name will come first, and then the first or second middle name, whatever it is, it will be a initial. Okay, so here you are supposed to write the author name. After the author name, you will write the article title, whatever is the title of the journal. Then you are supposed to write the journal title. Okay, it can be Indian Journal of Public Health, Indian Journal of Community Medicine, or IJPH, whatever it is. So whatever is the journal title, okay, in the short form. Then comes the date of publication, which year, which date, everything. Then date of citation, okay, when was it cited, and then what is the volume number, issue number, then location or the page number, 62 to 69 or 100 to 101. If it is not available, then if it is of a 5-page document, then 1 to 5. So this is how we are supposed to write. This is the style of Vancouver. So if you are taking any particular original article, then this is how you are supposed to quote it using a Vancouver style of referencing. And then at the end, you can write available from. So whichever URL link is available, that URL link you can just copy paste it over there. So this is how you are supposed to use a Vancouver style of referencing. Usually the first is the author name, the title of the article title, then the journal, what you say, the journal, then it is date of publication, then it is the volume number, issue number, and then the page number, and then the URL link. So this is how you are supposed to write. Now, if you are taking a book, not an article, then how are you quoting a book? First will be the author name or the author's name. Okay, same thing. Up to sixth author, you are supposed to write the name of the author. After the sixth author, you can just write it as et al. Then comes the title of the book. What is the title of the book? Bailey and Love, or Davidson, or Hutchinson, whatever it is. Then the edition, first edition, sixth edition, seventh edition. Okay. Then the city of publication. Which was the city of publication? Then who is the publisher? Then the year of publication 2009, 23, usually it must be the latest one. Okay, if you are quoting any book, see that it is of the latest publication and the latest edition, not the previous edition. Then number of pages in the book, or you can also write the chapter. Okay, chapter 2, chapter 3, and then you can write the number of pages in the book that you have taken or quoted for your study. Now if you are quoting a newspaper, okay, then you are supposed to write the author name, then title of the article, then what is the newspaper title, which edition it is, then which year, month and day of publication, and which section. Okay, then letter, the number, column number, page number, all these things will come in this particular newspaper article. Usually very rarely we quote any newspaper article, because usually in our dissertation 90% of the thing will be done by the books and the original article. Only rarely we go for the internet sources or the CME or the conference sources, but very rarely we go for the newspaper article. Then comes to a journal from library database or the internet source. Then you're supposed to write the author, then title of the article, then abbreviated title of the journal, then year, month and day of the publication, then what is the volume number, issue number, page number, and then finally what was the URL link from which it was available. It is always safer to put the URL link, especially if you're taking any particular source from the internet. Okay, you can just write available from URL so and so, and then just write the date on which you have accessed that particular URL. Okay, then if it is a website, again you can just write the author name, then title of the website or the internet source, then the city of publication, who was the publisher, then copyright date, then updated year, month and day, cited, also available from the URL link. So usually this is how we do the referencing. This is the style of Vancouver type of referencing. Usually if the referencing is not proper, then again you will get back a what to say of the review, you will get a notification that so and so was not proper, so please update it accordingly and then send back the thesis. So this is what you will get a remark. Okay, so please see that you write in a proper Vanco style. So please pay attention to this particular thing if you want to take a snapshot, because this is the most common thing, because article or the journal is the major source of your dissertation writing. Few of the journal will give a column in the below of the article saying that you can cite this article as. Okay, usually the newer journals or the newer editions or the newer what to say they usually give the citation, but if it is a older one, then you will have to supposed to write in this particular manner. Yes, so now this was all about your dissertation writing, right? So until here was your dissertation writing. Now we will try to focus on the study design and then how to calculate the sample size, which is the major part of your methodology, and then what statistical parameter can be chosen. Now coming to study design, I'm not going in detail. Okay, just to be a what to say, to just to give a summary. Usually we have two types: one is descriptive, one is analytical. Descriptive is usually what it is going to give you the hypothesis. What is hypothesis? Now, for example, I want to make a hypothesis that the prevalence of diabetes is so and so. That is your hypothesis. Analytically, they are going to test that particular hypothesis. So in descriptive, case report and case series are there. The only thing you take in the dissertation is a cross-sectional study. Okay. Then in the analytical study, you have case control, cohort, and then intervention or RCT. So usually what happens in the dissertation, most of the students have this comparative study. Okay. Now they are going to compare two particular surgical technique. Now they are going to compare two particular anesthetic agent or anesthetic procedure, all these things. So usually students are intended to write, or they tend to write it as RCT. Please don't make that mistake. It is not an RCT, because in RCT you are supposed to make any intervention and then you're going to follow for a particular period of time. This is what we're doing is a cross-sectional study. It's a cross-sectional comparative study. Okay, cross-sectional is at a single point of time you are collecting the data, whereas in the RCT or cohort study you are going to follow up them. There are going to be multiple visits. You are going to make any intervention. So please don't write it as RCT. Don't make that particular mistake, because again, if you write it in RCT, everything will change. Okay, so usually it is a cross-sectional study. It is a comparative study. Okay, you're going to compare two particular what to say parameters or two particular techniques at a single point of time. Okay, you're not going to follow them up and all. It is a single point of time. So it is a cross-sectional study, it is a comparative study. Okay, yes. So coming to sample size calculation, this is one of the most common sample size calculation thing you see in a dissertation. That is, for the cross-sectional study, n is equal to z square pq by d square. So this is what you always see. So now what all these parameters you will see. Okay, what exactly is this confidence interval, all these things. So now where do you get this prevalence or this particular P? This P you get it from the book or from the mother article that you have chosen or from the journal sources. Now, for example, if I say the prevalence of diabetes, now if I want to calculate the prevalence of diabetes in my particular study setting, then I have to search an article which is nearby vicinity to me that says the prevalence of diabetes in Bengaluru was 10%. Now I will take that prevalence for my sample size calculation over here. So I will write that P as 10 in my sample size calculation, and then I will quote whatever article I have selected. And this is the formula. Now comes here this allowable precision or error. So I will just talk to you about it in a few minutes. Okay, this is the sample size for cross-sectional study. Now, if you're doing a cohort or a case control study, then the sample size taken is P naught Q naught plus P1 Q1. So what exactly are these? P is nothing but P, that is the proportion you found in the controls or in the cases. If it is a cohort study, then it is a risk. That is, for example, exposed and then non-exposed. What was the prevalence among exposed, or what was the risk among the exposed? What was the risk among the non-exposed? Okay. So this is the sample size. Again, the alpha is nothing but the significance, confidence interval. I will tell you what exactly all these things in the next slide. Okay. And then if you are going for the clinical trial, this is the formula used to calculate the clinical trial. But usually we are more focused on this cross-sectional study because this is what we get more often in our study setting, because limited duration of time, and usually it is cross-sectional study because cohort study cannot be done in a 1 year of time. You require more time to follow up. Case control study is done for the rare entity. You are supposed to check the case, then match the controls. And then clinical trials is very rarely done because it requires a lot of what to say time duration, right? So yes, so what exactly is this confidence interval? So this is what we always hear, right? 95% confidence interval, 95% confidence interval. So 95% confidence interval means, now whenever we do any study, we compare. Now, for example, if I say the prevalence of diabetes in my study is 10, I'm going to compare it with the standard one, right? That is given in the book or in the mother article. Now, for example, yes, the book says that the prevalence of diabetes in India is 8%, or a study or a census or the NFHS data or the SRS data, whatever is the relevant data, that say it is 10%. Now, what is 95% confidence interval means? If I do this study 100 number of times, then 95% of the time my prevalence will lay in this particular range. Okay, that is called as confidence interval. 95% confidence interval means if I do this study 100 number of times in Bengaluru, then 95% of the time the prevalence will be roaming around 8 plus or minus something. That is called as confidence interval. What is precision or allowable error? Precision is how precise is your study when compared to the population parameter or whatever is given in the book, a standard parameter. You're comparing it, right? So how precise is your study? How much precise are you that your prevalence is going to be as near as the population parameter? That is called as precision. Okay, then what is power? Power of the study is how often can you get that precise value. Then what is p value? P value is nothing but, this is one of the most haunted thing, p value. Most of the students come to us, say, sir, I want p value significance. Sir, my guide is asking for p value significance. Sir, I want to show this parameter as significant. So what is this p value? I will tell you later. So what is the appropriate sample size? Because the sample size is less, you don't get a proper answer. If the sample size is more, you are going to waste the resource. Now we can explain all these things to this normal curve. So what is this normal curve? We all know what are the measures of central tendency, measures of central dispersion. That is the most basic parameter we speak in statistics, right? So what is measures of central tendency? Usually mean, median, and mode. So it says that what is the tendency of the parameter to be as center as possible in the normal curve. Okay, normal curve is nothing but the distribution of the population. Now, for example, if I say the prevalence is, what you say, 10%. So what is the tendency of those patients to fall at 10%? That is called as measures of central tendency. That will tell me. And if it is of all the three parameters, mean, median, and mode are equal, then we say it is a normal curve. That is how often are they trying to be in the center. Then what is what to say, measures of dispersion? That
Dr. Vinayak, your voice is not audible. Yeah, it will be rectified. Give me 2 minutes. Illa, illa, sir. Unmute yourself.
Okay, am I audible now?
Yes, yes. You are audible.
Yeah, yeah. Sorry for the disturbance.
You can project the screen, sir.
Yeah, sir. Yeah. Yes, I hope the screen is visible.
Yes, sir. Screen is visible. And one of the people asked to go slow also.
Yeah, yeah, yeah. Sure, sir.
Sure.
So yeah, as I was discussing over here, now this is the normal curve you can see. So that means to say 95% of the time, if I repeat this particular test, then the values are going to be in the range of 850 to 1450. That is the meaning of 95% confidence interval. Now, for example, if we take the mean as 1150, okay, so 95% of the time, that is, if I repeat this particular test 100 number of times, then 95% of the time, the values will be roaming in between this 850 to 1450. That is the meaning of 95% confidence interval. Okay, so this usually covers plus or minus 2 standard deviation. So the area between the plus or minus 2 standard deviation is called as the 95% confidence interval. Now, what is precision? Precision is how nearer are they intending to be nearer to the mean. That is how close are they to the mean. That is called as precision. If they're very close to the mean, then you will have a normal curve which is very steep. Okay, that is called as precise. That means to say your study is very precise because the mean you are getting is very, very nearer. Okay, that is called as precision. This is called as 95% confidence interval. Now, what is this error? Allowable error. You are allowing a 5% error. Okay, that is you are taking considering only between -2 to plus standard deviation. So whatever is there less than -2 standard deviation or more than 2 standard deviation, you are going to leave it off. That is called as error. You are okay, you are leaving it, no problem. I want to concentrate only in this particular thing, and 95% of the time it is roaming between these variables. Okay.
Excuse me, sir. Excuse me.
Yeah, sir.
Sir, in that below there is one that stop sharing and hide button is there, no? Can
Yeah,
you
yeah,
please hide it, sir?
yeah, yeah,
Yeah. Okay. Thank you, sir.
yeah. So usually what happens now, for example, when do we take more sample size and when do we take less sample size? Usually the students come to us, so please decrease the sample size. I cannot do 200, I cannot do 400, I can do only 50, or I can get only 100 patients. So why it is more difficult? I'll just let you an example. Now, for example, we'll take the prevalence of malnutrition. Okay, it is around 50%. Now this mean is 50. Okay, now, if you are allowing an error of 5%, okay, that means to say I will allow 45 to 55. So, if I am allowing an error of 5%, that means to say your study will give the prevalence of malnutrition between 45 to 55. Okay, that will not make any difference. Now, the India statistics says the prevalence of malnutrition is 50%, and your study will say it is either 45 or 55. So, it is not going to make any much difference. But the actual problem comes when the prevalence or the incidence is very low. Okay, if it the mortality is low, is very high. Now, for example, the prevalence is only 5%. Okay, or leprosy or any rare disease, if the prevalence or incidence is very less, then you cannot allow much of the error. Now, if the prevalence itself is 5 and you are allowing a 5% difference. That means to say your value will roam between 0 and 10. So you cannot allow it. The India says the prevalence of leprosy is 5%, whereas you cannot say it is 0 or it is 10. It is going to be a very, very huge difference. So that is why we cannot allow that particular sample size. So if in order to decrease the sample size, we will have to increase the error. And if you have to get a more precise value, then you have to take adequate or more sample size. Okay, so that is one of the major problem that we face. Okay, it is okay for the dissertation, but later on when you are going to do any particular research or article, and then you are going to want to publish it in a very good journal, then they will look into all these parameters. If you are allowing a lot of error, then it may not be accepted because it will not be a good study. The lesser the error, the more precise the value, the more nearer your values are to the mean or the population parameter, the better is the study. This is how we say. I hope it is very clear with you with this example. What is this 95% confidence interval? What is this area between the minus and plus 2 standard deviation, and what exactly do you mean by precision? Okay, this is very, very simple parameter. Don't get confused. Okay, these things are not a what you say high-fi words. This normal. 95% of the time your values will roam between 850 to 1450. That's all. This is the error. So less than minus 2 standard deviation and more than plus 2 standard deviation, you are going to leave it as an error. Okay, adjustable. Okay, so this is the example of normal curve, and how exactly are you deriving the sample size based on this. So now this d is nothing but error. So if you increase the error, your sample size will decrease, and if you decrease the error, then your sample size is going to increase. As simple as that. Okay, so if you want lesser sample size, then we will have to increase the error. Okay, that means to say your study is not a good study because you are allowing a lot of error in your study. So that is the reason why we want adequate sample size. But yes, during the thesis or the dissertation, because of the time constraint or the resource constraint, sometimes it has to be done. But as I told you, it doesn't make any much difference if the prevalence is more. But if the prevalence or incidence of a particular disease or the entity is lesser, then you have to be more careful because you cannot allow much error. The prevalence of anemia is 50%. No problem. If your study says 40%, it is okay. But if the prevalence in the India or in the statistics itself is only 5% or 3%, then you cannot say in your study. Now, for example, we had COVID-19, right? So we have the case fatality rate was 3%. Now in your study you cannot say it as 10% or 0% or 0 or 1%, right? You cannot allow that much error. So as the disease become rare, as the incidence is less, as the prevalence is less, okay, as the case fatality is more, then you have to be very, very precise with your sample size. You cannot negotiate with the sample size too much. Okay, if the prevalence is more, if it is not a life threatening disease, okay, if there is already a policy in that particular disease or in that area, then okay, you can allow a particular error or you can allow some manipulation so that you can have a lesser sample size. Okay, this is the gist of sample size calculation, and you have to justify why have you taken this particular sample size in your study. The only thing is you have to justify whatever is your sample size, and I told you three parameters for justification. One is sample size calculation, second one is universal sampling technique, and third one is based on the 3-year data that is available in your hospital setting. Okay, so I hope I am clear with this particular thing. Now comes the most important thing, data. So now you have collected all the information. So you had 100 patients, 200 patients, whatever was your sample size, you have collected all the data. This data will be usually either qualitative or quantitative. What is qualitative data? That is nominal, that is in the same, in the, it will be in the form of a name. Now age, sorry, not age, gender, male, female, right? And then it can be a what to say, your hometown. It can be rural area or it can be a urban area. So it is in the form of a name, that is called as qualitative data. Color of the eye, okay, it can be blue, black, green, like that. Whatever is in the form of a name, it is called as nominal data. What is ordinal data? The data that you are supposed to present in an order. Okay, now for example, TNM classification, staging, or BMI, you cannot write anything. You are supposed to order it in a particular way. That is called as ordinal data. So whatever data you have collected, either it will be in the form of a name or in the order, or it can be a quantitative data. That is, it can be an interval or a discrete data. Now for example, age is either 10 years, 15 years, or 20 years, or it can be a continuous data, weight. It can be 30, 30.1, 30.2, 30.3, or 40, or it can be in the decimal point, or it can be in the ratio, all these things. So whatever data you collect, either, so it all allows in this particular four parameters. One is it can be in the form of a name, then it has to be in a particular order, or it can be a single value. Okay, now for example, weight, height, all these things can have a decimal point, right? Or it can be a discrete data. So this is the data that you have collected in your study, and then you're going to enter it in the master chart. In the master chart, you can usually write it, okay, male, female, something like that, or you can code it, 0 is male, 1 is female, like that. Okay, you can enter the data in the master chart either as it is, or you can code them and then you can enter it in the master chart. So this is the data, raw data. So now data presentation. So now you collected the data, entered it in the master chart, you have done the analysis. Now how will you present it? So you'll present it in the form of a table. The table can be a frequency table. Frequency table is, it will give you the number percentage, right? So less than 10, for example, less than 30 years, 10 patients, 31 to 40 years, 20 patients, 41 to 50 years, 80 patients, more than 60 years, 10 patients. It is called as frequency table. You will write what is the age group, and then you'll write the number and then write the percentage. That is called as frequency table. Male 50 patient 50%, or female 40 patient 40%, like that is called as frequency table. Or it can be association table, where you are trying to find an association between two parameters. Now you want to see prevalence of diabetes according to gender. Male, what is the prevalence of diabetes? Female, what is the number of diabetic patients? It is called as association table or correlation table. Okay, so the table or the tabulation will be in this form. Or it can be a graphical representation. Below the table you will put a graph. It can be a pie chart, simple pie chart, or scatter diagram, line diagram, bar diagram. So based on the type of data, type of association, you will put a, or you will choose a particular graph. Okay, so now comes the statistical analysis. What is this univariate analysis, bivariate analysis, multivariate analysis? This is the most common thing. Univariate analysis. Okay, we'll go with one by one. So what exactly is this? Univariate analysis means you're taking one variable at one particular time, that is weight. Okay, so what is the weight? Less than, okay, first you put a table, less than 50 kg, 50 to 60 kg, more than 100 kg. Height, okay, less than 100 centimeter, more than 100 centimeter. Or age, as I told you. So one particular parameter, you are going to choose it at one particular time. It is called as univariate analysis. Now how will you present this data? It can be presented in the form of a mean and standard deviation. The mean weight of the participants in your study was 60 kg plus or minus 8 kg. That is a standard deviation. That means to say the least weight was 52 and the maximum was 68. That is what it means, right? Mean plus standard deviation. The mean was 60 kg, standard deviation is 8 kg. That means to say the patients in your study, the weight was deviating from 52 to 68. That is your 95% confidence interval. So 95% of the patients are having this particular parameter. Less of the 5% can be having less than 52 or more than 68. So you express this univariate analysis in the form of mean, standard deviation, or median, or range, or it can be rate and then percentage. So this univariate analysis is the most simple thing. Each parameter you will rate. Now for example, gender, male is 20%, female is 80%, something like that. So univariate analysis is the most basic thing that is done in a statistical analysis, which will give you one particular parameter at one particular time with mean and standard deviation, the most commonly chosen thing. Then it can be median and then interquartile range or range. Okay, yes. Then what is bivariate analysis? Here you are going to take two variables at a simultaneously at a single point of time. That is, for example, you want to see weight and gender. Now among male, how many are having overweight, how many are having less weight, like that. Okay, you want to take two variables at a simultaneously or at a single point of time, weight and age, weight and height, like this. So two variables are taken simultaneously. Here, in order to establish a relationship, here you will have to choose a particular statistical tool. Okay, it can be t-test, chi-square test, or whatever it is. We'll go to it later. So this is how we are going to do a bivariate analysis. Then what is this multivariate analysis? Here, if you are going to take more than three variables simultaneously, now age, gender, and then weight, or something like that. So three parameters at a single point of time. If you want to see how are they revolving around each other, then you will take a multivariate analysis. Okay, usually our dissertation 50% to 60% will be bivariate analysis, then remaining will be, sorry, most will be univariate, then bivariate, very few dissertations will be involving a multivariate analysis. Okay, now in order to do all these things, so which is the statistical tool you want to choose? This is the most common confusion every student usually face. Okay, when to do t-test, when to do chi-square test, what other tests are available, okay, how many tests are available, how should I select, or should I just follow whatever the statistician says? So this is one of the most common thing that is faced. Now how to choose a statistical test will depend on the objective of your test, whether it is a descriptive study, comparison study, or an association study. What is the type of variable you're trying to associate in between nominal data, ordinal data, or a discrete data. Okay, so this, and then what is the sample size? So depending all these things, you will choose which statistical test to see. So before that, we have something called as parametric test and then non-parametric test. Parametric tests are used when the distribution follows a normal curve. And how will you know whether it's a normal curve? If the mean, median, and mode are equal or same in your study, then imagine or then take into consideration that your distribution is following a normal curve. Then you will use any of these parametric tests. Okay, usually it is a Z test or T test or ANOVA test. Okay, this is called as parametric test. But if the mean, median, and mode are not coinciding with each other, one variable is more or one variable is less, then we will consider it as a non-parametric thing, and we will take the non-parametric test like Wilcoxon test, chi-square test, Mann-Whitney test, one-way ANOVA, all these things. Okay, so whatever follows the normal distribution, take parametric test. If it is not following a normal distribution, then take non-parametric. And how will you know? Just calculate the mean, median, and mode, and then you will get to know whether it is a normal curve or it is a non-normal curve. Okay, so here you can see this is how we choose a statistical test. Now this is left side column, you can see it depends on the data, whether it's a nominal data, ordinal data, or it's a ratio or interval with normal distribution or with non-normal distribution. And then here you're having a simple sample or two sample comparison or two matched or three or more. Then here is the thing. So either you take chi-square or t-test, Wilcoxon, Mann-Whitney, okay, paired t-test, Kruskal-Valley test, one-way ANOVA, Friedman test, all these things, McNemer test, all these things. But all these things are not necessary for a dissertation thing. Okay, so usually in a dissertation, we are not going to use most of this statistical analytical tool. We use very commonly only very few things. Okay, now to simplify how to choose, one is you will get to know whether it's a normal distribution or not. Okay, now if you think it is a normal distribution, that is when the mean, median, and mode are coinciding, then see the sample size. What is your sample size? Is it a large sample size or a small sample size? Okay, if it is a large sample size, then go for Z test. Simple. If it is a large sample size, then go for Z test. But if the sample size is less, then go for a, then you see whether the sample is independent or not. So what is the sample being independent or not? See, dependent sampling is, now for example, you are measuring a blood pressure on the same individual at multiple point of time. Now we are subjecting a patient to a treadmill test. Okay, or you are going to take three readings of a blood pressure on the same person, on the same patient. It is called as paired, or it is called as dependent sample. Then you will go for paired t-test. Okay, but if the sample is independent, then you will go for unpaired t-test. Very simple to take. You'll see the sample size, large sample size, Z test, small sample size, go for T test. That's all. If it is the following normal distribution, see the sample size, more sample size, Z test, lesser sample size, T test. Okay. Then if the normal distribution is not followed, that means to say mean, median, and mode are not coinciding, then you have to see whether the sample is independent or not. And if it is yes, and if all the values are less than 5, we go for Fisher's test, or we are going to chi-square test. And usually most commonly taken is chi-square test. Okay, if it is sample is not independent, then we go for McNemer test. But I will tell you the most common tool we use is Z test, T test, or chi-square test. And one more thing is ANOVA test, because ANOVA will give you multivariate analysis. That is, we can what you say compare 5 parameters at a single point of time. So we take ANOVA test. Okay, so this is how you choose a particular tool. Very simple. Normal distribution, calculate the sample size. Large, go for Z test. Small, go for T test. Sample independent, values are less than 5, Fisher test, which is very rarely we are using. If it is more than 5, because most of the time all the parameters will be more than 5, we go for chi-square test. Okay, so this is a simple tool. Okay, don't worry about this particular thing. See, even if you learn softwares like SPSS, anything, it will give you multiple things, but the thing is you should know which statistical tool to apply. If you don't know which statistical tool to apply, then there is no use even if you know SPSS or any other particular software. Okay, so this is one of the most common thing. As I told you, all these tests are used especially in higher statistical analysis or in the what you say advanced journals, all those things. But for our dissertation, if we are very well versed with Z test, T test, chi-square test, and ANOVA, this is more and more sufficient. Okay, if you know how to calculate mean, median, mode, and then your standard deviation, interquartile range, then 50% of your analysis is done. That is what we require for the univariate analysis. Then for the bivariate analysis, we use t-test or chi-square test or z-test. Again, in z-test and t-test, usually we see t-test only. Z-test is very rarely done. So between two variables, t-test or chi-square test. And if it is having more than two variables, then go for ANOVA. So this is how we follow, or this is one of the most common thing required in the dissertation. 90 to 95% of the dissertation statistical analysis will require only these three particular tests. One is t-test, one is chi-square test, one is ANOVA test. Only these three parameters, if you know how to do it, it is well and well sufficient. You just to have to do univariate analysis, bivariate analysis using t-test and chi-square test, multivariate using ANOVA test. That's all. This is the dictum. Okay, just follow these things. Don't worry about the other particular test or other fancy statistical tool. That's all. Whatever you do, the aim of the statistical tool is to say whether the thing is significant or not based on the p-value. That is what everybody is concerned of. Sir, p value is not significant. My guide is asking for this particular p value to be significant. That's all. What is the significance? That means to say whatever you have done is significant. That is, we take p value as 0.05. That means to say that is nothing but 5% allowable error. If your p value is less than 0.05, that means to say you have met your 95% confidence interval. That's all. Okay, if the p value is more, that means to say it has not met your 95% confidence interval. So all these things revolve around each other. This confidence interval, okay, then this mean, then your normal distribution, then precision, and then p-value. All these things revolve around the same particular thing. Okay, same particular thing, but different way of seeing those things. Okay, so that's all. If the p-value is less than, now somebody say, sir, I want p-value less than 0.01. That means to say you are allowing a only 10%, not even 10%, only 1% error. Okay, that means to say you are trying to see that your test is very, very precise. At that time, you require a very large sample size. Okay, that's all. P value 0.05 means you are allowing 5% error. P value 0.1 means it means you are allowing a 10% error. That's all. Okay, that is all. So that depends on the p value. Now coming to software, so do you really need software like SPSS or epi info for statistical analysis? Can it be done without any software, without the help of statistician? Then it's definitely a yes. Okay, so we can, for your dissertation at your level, you can do it on your own using MS Excel. No other software is required. Okay, other than this, in the website or all these things, there are a lot of statistical tools that are available. Okay, there are various softwares like SPSS, EpiInfo, or software, G software, many things are there. Okay, but it can be done with only MS Excel because for your dissertation, no higher standard of statistical analysis is required. Your sample size is usually less. It does not cross 400 to 500. It is usually less than 500. So definitely you can use MS Excel and the various available tools in the what you say so in the internet itself to calculate your or to analyze your data. Okay, so yes, you can calculate or you can do your own statistical analysis using MS Excel sheet. Okay, now how to use MS Excel sheet, how to calculate all these things again will require a lot of time and it will be a separate entity. Okay, if your participants are interested in learning how to use MS Excel sheet in order to calculate or in order to do the statistical analysis for your dissertation level or for your whenever you want to present any journal or whenever you want to do any presentation in the conferences, all those things, you want to do your own statistical analysis, you want to have your own results, then you can definitely use MS Excel sheet. In MS Excel sheet, everything is available. Okay, so if you people are interested, then you can just ping in so that we can have another session on MS Excel. That particular session will only be on how to use MS Excel for your statistical analysis. Okay, so this will conclude my topic on biostatistics in dissertation. Okay, we always roam around p-value. So who knows p-value? Everybody will say yes, I know what is p-value, but who can explain? So it is always a question mark, right? So please don't roam around. Sometimes we can just say the finding was clinically significant but not statistically significant, that's all. So don't worry about this p value, but few of the guide or the students, they are very what to say, concerned about the p value. I want it significant, I want it significant. Okay, so that is nothing but p value less than 0.05 means it falls under 95% confidence interval and you're allowing only 5% error. That's all, that is all you want to know about the p value. Okay, and I hope I am very clear. The gist was in order to make you understand how to write the dissertation. Okay, what are the various sample size technique tools, and then what are the common biostatistical tool that you will be doing, especially the univariate analysis, bivariate analysis, and the common statistical tool that you use is t-test, chi-square test, and then ANOVA test. Okay, so I hope I have met the expectation of you people. So I really thank you all, and if anybody is having any doubt, then we can have a discussion over here. So thank you all.
Yes, it was very interesting topic. And yes, participants, you can type the questions in the chat box so that Dr. Vinay could answer this.
Yeah, so I have a question saying that, so while selecting a sample size, we have to think of error. So how error affects if we are doing a universal sampling? Yes, very good question. See, the error we consider only when you are calculating a sample size, but what happens most of the time, the topic that is chosen by a student may not be, or the disease may not be, what to say, may not be getting a lot of cases, especially if you select cases or patients like having cancer or something like that. Then it is very difficult to have large number of cases. It is difficult even to get 100 patient in that particular duration of 1 year or 1.5 year. At that time, you are supposed to take a universal sampling. At that time we cannot do anything about the error. Okay, we cannot do anything about the error. The only thing is you are going to analyze on all the patients that you got in your study. Okay, so when you're taking a universal sampling technique, or when you're selecting, that is based on the last 3 years data, this is the average number of patients and I'll be taking these patients, then we cannot do anything about the error. That is something that we have to go on with. Okay, so error comes into play only when you are trying to calculate the sample size based on the formula. I hope I've answered your question. Okay. Yes, to calculate, we want d in the formula. See, in the formula we had, that is z square pq by d square. That is nothing but confidence interval, 95% confidence interval. That means to say the area between minus and plus 2 standard deviation, and it is usually the value is 1.96. Okay, so 1.96 square into prevalence into q is nothing but 100 minus p. So what is this d? So this d is nothing but the error that you are allowing. Okay, it can be either absolute or relative. Absolute error is, like for example, we take 5% or 10%. That means to say plus or minus 5. What is relative error is relative of p. Now, for example, the prevalence is 50, and if we take relative error is 10%, that means that is 10% of the p. That means 10% of the 50, it will be 5. So that is how you take the d. Either it can be absolute error or it can be relative error. That is nothing but how much error are you allowing around your mean or minus percent to standard deviation. Okay, again we manipulate with this particular d whenever student comes to us. Now for example, we usually take the maximum allowable error is 20% of your prevalence. If the prevalence is 10, then the maximum allowable error is 20% of the prevalence. That means to say it is only 20% of 10 is how much? 20% of 10 is nothing but 2. Okay, that is the maximum allowable error. But usually what happens when the student comes to us, sir, I want lesser sample size, then we try to increase this particular d. Okay, that is allowable in your dissertation, but usually it is not advised when you're going to do any particular good study and you want to present in a good journal, or you want to present oral presentation or something in a conference. Okay, I hope I've answered your question. So examples of each data type, please. That is what nominal data. That means to say it can be color of the hair, color of the eye, it can be gender, male, female, like that. Ordinal data is your TNM classification or anemia classification. That means to say you are supposed to write it in an order. Or BMI classification, you cannot write BMI more than 25, then you cannot come to less than 25. No, it has to come in an order. That is called as ordinal data. Discrete data is a complete thing. Okay, you cannot have a decimal point in that. That is called a discrete data. Then one is continuous data. It is either weight, height, or age, which can come in a fraction or which come in a decimal point. That's all. So cut off large and small sample size. So usually in order to have, so Gino again is asking cut off large and sample size. Large sample size is okay. You can take up to 1,000 or 2,000, even 3,000. It's fine. But usually small sample size, we always say at least minimum 30. Okay, if you want to do any statistical test and you want to find any significance, then at least the minimum sample size required is 30, not less than 30. You cannot take anything less than 30. Excuse me. So please see that you always take sample is at least 30. Okay, not less than 30. Yes, Adil Patel has told, sir, p-value and confidence interval opposite of each other. In a way, yes. 95% confidence interval means p-value 0.05. Okay, that's all. So if you're taking 95% confidence interval, p-value will be 0.05. If you're taking 99% confidence interval, then p-value will be 0.01. That's all. Okay. 95% confidence interval that you are including in your minus and plus 2 standard deviation. Then remaining whatever is there, it is called as the p-value. Is PG student expected to do manual analysis by calculator? See, it's very difficult thing to do. Okay, you cannot take a calculator and then you cannot do the manual analysis. It is always better to go for the MS Excel sheet. In the MS Excel sheet, everything is available, or various other tools are available in the what to say your internet. Okay, you can just go Google it. You can put in the search engine as to chi-square test calculator, t-test calculator. You will get everything. But the only thing is you should know how to calculate it. Okay, and then everything has a few what to say limitation.
Hello, Dr. Vinayak. Your video is stuck. Sorry, guys, some technical glitch. Give me one moment.
Yes, I am sorry again because there was some technical issue again. Okay, I was answering the questions.
Okay, you can continue. You can continue the same, sir.
Yeah, yeah. So any other question? I think I had stopped at somewhere. Less than 500 will be a small sample size. You can say so, but less than small is less than 30. Okay, anything more than 30 is adequate sample size. Usually that depends on again the adequate sample size depend on the what you say your prevalence or the incidence. Okay, depending on that only you can say whether your sample size is large, small, or adequate. Other than that, we cannot make any justification whether the large sample size or small sample size without the information. So Adil Patel is asking if we collect any line from a report like TB report, then how to cite them. I didn't get your question exactly. So TB report. So please, what exactly are you trying to ask? I couldn't understand by that particular sentence. Okay, in the referencing. Okay, in the referencing, you can just write. For example, it can be a what to say. You can just write the title of your TB report. Okay, it was published by which particular agency, NTEP or NICSHI or something like that, and then the year of the reporting, and then you can just mention it. You can just copy the URL link. That's all. Okay. Yes. Any other questions? In the PG examination, will the examiner ask for the original software or can we show him the free version? In the examination, they will not ask you anything about the software or the free version of thing. They'll just have a discussion on your dissertation. Okay, they'll just ask you what was your study, how did you do it, what was your primary finding. That's all. They will not ask you how did you calculate the sample size or how did you do the analysis and all those things. Please don't worry about all those things. Those things will not be asked. Okay, so don't worry about that. MS Excel itself is a very good tool to calculate your or to analyze your data. So kindly explain what is effect size and how it is used to calculate the sample size. Effect size and all, usually it is used when you're doing a population based studies. Okay, so in our day-to-day dissertation thing, we are not going to take effect size and all. So when we are doing a cluster sampling technique or in the population parameter, then we go for the effect size. Okay, so very rarely we take that particular thing, so there is no need to worry. So which AI website can we use for writing ROL? So AI website, yes, it's the new thing. I am not very much oriented with the website in order to write the review of literature, but there are various agencies through which or the software through which you can just place all the articles that you have downloaded, and then you can write and automatically it will cite in a referencing page. Okay, that can be done. Yes, AI is a new thing and I don't know how much capabilities or how can we utilize that particular thing. That is a new entity, but yes, various other softwares are available in which you can just place the articles and then you can start writing and automatically it will cite in the referencing. Small p versus large p, nothing. See, small p, large p, the only difference is the error you are allowing. That's all. How much error are you allowing? Lesser the smaller the p, that means to say very less is the error. Larger is the p value, more is the error. That's all. Okay. So kindly share the PPT, sir. Sure. If anybody is interested, I will just share it with the Samruddhi Elite educators so that they will see if it is required. Then they'll look into it. Okay. Yes. So I hope this session was informative to you all. And if any further thing is required, as I told you, any use of Excel sheet or anything else, then definitely you can ask me so we can arrange a talk for that particular thing. Okay. Can you please suggest some sources for reading biostatistics like books or website? Okay, that depends on how much analysis do you want to do. There's a book on statistics by Dikshit, which is usually very commonly used. You can either use that, or there's a book by AP Kulkarni, okay, which is just a how to use Excel sheet in biostatistics. It's a very small book. You can just use it. Okay, so other than that, what was given in the textbook, it is fine. Okay, so please repeat choosing statistical test is possible. That's what statistical test will depend on whether the sample is independent or not. So depending on the sample size, T test, Z test, and then if it is the unpaired or non-parametric, then you're going for K-square test, and multivariate you're going for ANOVA test. That's all. Okay. Yes. Can we get some data on practice statistics any site? Yeah, that's what you can do it. Uh, at any site. There are various sites available, the search engines. In that you can, there is something called as sociostatistics.com. Okay, then there is one more sci software.com, in which you can use it. Okay, you can just put your master chart. Depending on the master chart in the Excel sheet, you can do it. Yes. So I hope this was an informative session. So I thank you all, and over to you, Dr. Raghu sir.
Yes, yes, sir. It was very wonderful presentation from your end. Hope all the participants enjoyed. And yes, how many want this MS Excel webinar? You can type yes in your chat box. Yes, yes. Okay. Sure, we'll connect one more webinar regarding the MS Excel usage. Yes, surely we'll conduct one more webinar. And yes, Dr. Vinayak, it was a wonderful session from you. Hope all our participants got a benefit out of it.
Thank
And not only MS Excel, if you want any other classes, anything else, you can please pin me on the website address like Samruddhi Elite Educators at gmail.com so that we can have the classes. Okay. Yes, fine. And thanks a lot, sir. Hope everyone enjoyed the session. Thank you all for attending.
you, sir. Thank you so much.
Okay.
I thank Samudra educators for giving me an opportunity. And again, as people are asking, if you want any particular topic, yes, as sir told, you can just ping it to us. So we'll try to arrange all those things. And hands-on, again, that will depend because hands-on, you'll have to come to a particular place, or online hands-on is possible. So we'll see what best can be done. Okay. So thank you all.
Yeah, sure, sir. We'll see what best can be done. And regarding the PPTs, right now we'll be providing this recorded video itself after some time. Yeah.
Thank you all. Thank you so much. Thank you, sir.
Thank you. Thank you, sir.